does vitiligo treatment take, and what is the cost?
Because vitiligo is a chronic condition and it is unpredictable, it's difficult to put a timeline to how long the treatment is going to last. In the optimum situation, I would see you or your child with vitiligo, recommend a treatment and see you back in 3 months' time or earlier if needed. And if things have gone as planned, then we might choose to part ways at that point. And that would be the end of treatment. However, we do sometimes find that if you have got a tendency to vitiligo, there is a possibility of developing other patches, or some patches might be slower to improve with some of our treatments. So there might be a need to see you for a longer period of time. That also in part answers the question in terms of cost. It could be that you might simply be looking at the cost of consultations and the cost of the prescription that you might have. If there are certain treatments like phototherapy that are sometimes used, and that does carry an additional cost. And the other thing is that I would often want to, on the first consultation, want to do a set of blood tests. Now that's important to mention because even though vitiligo in itself might not bother you or might not bother your child, it is important to say that sometimes these autoimmune conditions can come together or they come hand in hand. So we would want to check, I'd want to check your blood tests, and that would include things like your thyroid levels and some vitamins known as B12, vitamin B12, and your glucose levels, because those are common things that can also be affected. That doesn't mean to say that, in most cases those blood tests are fine, but it's an important thing to take into account.
If you notice that you have any of the symptoms or the conditions that we've just discussed, we invite you to book a consultation with Miss Penelope Pratsou, where she'll be able to assess your condition and give you a treatment plan.